My role with Bloomington Public Health is to serve older adults in the city of Bloomington. We primarily work with the age group 50 plus. We essentially are here to catch people who are falling through the cracks, who maybe are not connected to services in another way. It's changed a lot during COVID. Our role as local public health is to prioritize anything to do with COVID. So initially that was, being that I was in senior health, getting involved with long-term care testing, coordinating testing between Minnesota Department of Health, the National Guard, and different long-term care facilities in Bloomington, Edina, and Richfield. The biggest challenge, I would say, is being able to even have a conversation because of so much of what we did with population health was group gatherings, seeing people in groups, seeing them at Creekside. Unless we were testing them, we were not able to see them. So what really happened is we had to get creative to find ways to connect with seniors and keep them safe since their population was so disproportionately affected. So our job started to become almost a little bit of fundraising, gathering people together and doing our drive-through events so that seniors can be safe. They were able to drive through. The first one we did was a resource fair. We had a phenomenal turnout. But we've been having these events so that we can wave at them, smile. We're trying to do them every month so that they can put it on the calendar and have something to look forward to. We have some that just want the socialization. They feel really isolated. I've had one or two share with me they've lost their spouse due to COVID. So now they really are alone, and just even that one time a month that they can get out and chat with somebody a little bit through a window and have someone smile at them brightens their day.
I came up to Creekside every day. It was my home away from home. I wanted to socialize. The camaraderie, the coffee, the people. I really miss it.
I started to really think about their mental health. We had also done a survey over the summer and people felt their physical health was good, but the feedback was their mental health was not. And I remember when I was meeting with seniors before how lonely they were and isolated then. So I was so concerned about what life was like for them now, and I just felt determined to find a way to let them know that we are still thinking about them and to stay connected with them in any way we can until we can meet face to face again. You don't notice public health if things are going well. And it's, you don't think about it, but your drinking water's clean, your community's healthy, you're not seeing a resurgence of measles or tuberculosis. I mean, public health is really just keeping things running. It's not until a situation like this, when you have a pandemic, when public health becomes visible. I'll be okay if we're invisible again to people because that will mean the pandemic is well under control.